The other question will be asked, can we reduce complications in hypertension with effective treatment? The answer is yes. We can reduce myocardial infarction prevalence in hypertensive patients by 20%. Not only that, but we can also reduce transient ischemic attacks and stroke in 40% if you have good control of your blood pressure. And not only that, last but not least, heart failure. You can reduce heart failure by 50% if you have effective treatment. And effective treatment means you have to go to certain targets. What are the silent complications of hypertension? Do we have a complication which the patient does not feel? The answer is yes. The patient doesn't complain of left ventricular hypertrophy. He doesn't complain of albuminuria. He doesn't complain of aortic dilatation. He doesn't complain of accelerated aortic atherosclerosis or insulin resistance. So these silent complications are extremely dangerous because the patient will not complain. What is your duty here is to select certain patients who have long-standing hypertension. You have to look for these silent complications. Very simply, an electrocardiogram or an echocardiogram, a urine examination for albuminuria, accelerated aortic atherosclerosis by lipid profile, an X-ray chest sample for aortic dilatation, and insulin resistance by doing a glycemic profile. This is very important. How to measure blood pressure? This is extremely important because if you don't measure your blood pressure properly, you will have erroneous results. For instance, a patient comes to you in the clinic with a blood pressure of 155/100, and he's tachycardic and he has very high sympathetic overtone, and you are wearing a white coat. This is what we call a white coat effect. If you measure the blood pressure once or twice or thrice in the clinic, to your astonishment, you will find his blood pressure going down to 130/80. So this patient is not a patient to take treatment, but to take lifestyle modification. The preferable way of measuring blood pressure is, of course, in the office, in the clinic. He can measure the blood pressure at home with a home blood pressure monitoring, a digital apparatus, or we can resort to ambulatory blood pressure monitoring in certain patients to detect sustained hypertension from white coat hypertension, etc. Another way of measuring blood pressure, of course, arterial blood pressure, when the patient is in hospital or performing certain operations, we can resort to intra-arterial catheterization blood pressure recording. What are the precautions which you take before blood pressure is recorded? Many of us, we fall in this hole. First of all, the patient should be quiet, should not be anxious, should be fasting, non-smoking, should be sitting at the table. The level of the blood pressure apparatus should be at the level of the heart, and the patient, of course, should be in a room which is not very hot or not very cold. The cuff which you measure your blood pressure should be of an adequate size. You don't put a usual cuff with a patient with a fat arm. You have to have an extra cuff. And on the other hand, you have an infant or a child, you have to have a smaller cuff. So this is very important. Measuring blood pressure in the clinic or at home should be done several times, and don't forget that.